Thank you again for joining us, everyone. Good afternoon, and welcome. So, NCBA welcomes you to our webinar on aging well and fall prevention. Ms. Keisha Lewis of Weldom LLC is presenting our webinar today. Ms. Lewis is a practicing occupational therapist and a certified diabetes care and education specialist with more than 17 years of experience working in the field of, in the fields of human services, mental health, and physical disability. She serves as a consultant with the Health and Wellness Program for NCBA. In 2019, Keisha co-founded Weldom LLC, an aging in place consultancy. Keisha's ultimate focus is empowering individuals with the skills they need to be independent in their environment without fear. Thank you for joining us again, Keisha. Welcome, and I turn it over to you. Thank you.
All right. Thank you, Ms. Tellisford, and welcome everyone. Today we're going to talk about a timely topic on aging well and fall prevention because actually next month, September, is recognized as National Falls Prevention Awareness Month, with National Falls Prevention Awareness Week starting September 22nd through the 26th. So look for things in your community that represent and talk about fall prevention. That's happening next month. So here we go. So our goals today are we're going to define what's meant by the term fall. We're going to discuss some falls myths and facts. We're going to discuss fears of falling. We're going to discuss some risk factors of falling and identify if you are at risk. And then we're going to identify some ways to reduce your risk of falling. So as we look at what is a fall, I'm going to give you a definition. So a fall actually is to leave an erect position suddenly and involuntarily. And this could include slipping or tripping. And it does not include those falls caused by medical events. So, and this is Webster's definition of fall. According to the CDC, more than 1 in 4 adults over 65 fall every year. And falling one time doubles your risk of falling again. So if you experience a fall once, you're more than likely to experience another fall. And in 2018, an older adult fell every second of every day. I thought that that was so alarming that that many falls are occurring. So now we're going to talk about some myths and facts with falls. So sometimes people say, I'm not going to fall because I'm in good shape. Some people think that falling is a normal part of aging and you just have to deal with it. But I'm going to tell you, falling is not a normal part of aging. And by the end of our presentation, we'll learn some ways to prevent falls, okay? Then some people say, if I limit my activity or just stay in my home, I will not fall. That's not true. Because staying at home or limiting your activity, it actually could cause you to lose some of your independence and your strength, as well as put you at risk for social isolation. So we don't want you to just stay at home. Another myth is I haven't been exercising at this point, so I can't gain any strength. Why exercise? Well, the truth is we actually lose muscle mass as we age. However, exercise can partially help you restore your strength and your flexibility. So it's never too late to start an exercise program. So you can start today and you can gain more muscle mass and more strength. Some people also believe that using a walker or cane makes them dependent. Well, that's not true either. Walking aids are very important to be able to help older adults be able to maintain their independence and maintain stability. However, you need to make sure that you use the devices safely. So consult with your doctor or your therapist to make sure that you are using the device safely and you're using the correct device. So let's talk about falls and can we actually prevent them? In short, yes, falls are largely preventable, and that's what we're going to be able to talk about today. So, what are some of the reasons that falls happen? Some of the reasons are related to age-related changes, and that could be your balance or your gait, so how you walk as you age. So, as we age, most of us tend to lose our coordination, our flexibility, and our balance. And primarily, this is attributed to us being inactive. So, this can make it easier for us to fall. Then we have changes related to vision. And so I want you to think about in your aging eye, there is less light that reaches the retina. And this can actually make contrasting edges or tripping hazards or obstacles that are on the floor a little bit harder to see. And then there's the medication factor. So, some prescription medications and over-the-counter medicines can cause dizziness or dehydration. And so, some of these interactions with these medications can lead to our increased risk of falling. Next, we have environmental factors. So, environmental factors can include, which we're going to talk about more, but it can include things in the environment. So, things we have on the floor, our bathroom and how that is set up. Those are all things that we're going to look at and talk about. Then we have underlying health conditions. Underlying health conditions or progression of chronic conditions. So, chronic health conditions like Parkinson's disease or multiple sclerosis. And what I want you to know is that over 80% of older adults have at least one chronic illness, and that could be diabetes or stroke or arthritis. And often these chronic conditions increase the risk of falling because it results in a loss of function or inactivity, even depression, or even taking multiple medications. And then other times falls happen, just simple accidents that happen in the home. So when we talk about the fear of falling, how does your fear of falling put you at risk? So I'm going to go through this table because I think it explains a lot here. So if you have a fear of falling, what that could eventually lead to is that you decrease your activity because you fear falling. So people who fear falling, they will limit their activities. And then when you limit those activities, then limiting these activities can in turn cause someone to be weaker, which then can increase their risk for falling. And then that also leads to isolation. So, weakness and social isolation can go hand in hand because if you're weak, you may limit your community outings and your community engagement, and you don't go out with friends and you don't socialize anymore. And then that social isolation can then lead to depression because if you're at home, you're alone, you're not with friends, or you're not with family, that can lead to depression. So the fear associated with falling can cause multiple issues. So some of our fall risk factors. So let's talk about the things you can change. The things you can change is your physical inactivity. So if you're not active, we can work on becoming active. We can change our home environment, and we're going to talk about that a little bit. For vision, we can get our vision checked. We can go see the ophthalmologist and make sure that we have good vision. Medication use, we can talk to our doctor or our pharmacist about the medications that we're on. Fear of falling, we can address that. We can work on social isolation and weakness and improper use of assistive devices. So those are all categories of things we can work on and change. Then we have the things we can't change. So we can't change our age, we can't change our gender, and then we can't change our ethnic background. Okay. So as we go on, we're going to talk about some of those physical as well as environmental factors, things that we can change. Then when I talked about earlier, chronic conditions and falls, chronic conditions, they can contribute to your risk of falling. So if you have diabetes or arthritis, stroke, neurological conditions like multiple sclerosis or Parkinson's, chronic pain, depression, chronic obstructive pulmonary disease, or even sleep disorders. These are all chronic conditions that can affect your risk and increase the risk of falling. And then there's tools to be able to determine your risk factors. So the National Council of Aging has this great tool called the Falls Free Checkup. And you can go on there, whether this webinar is for you or your loved ones, but you can go on there and you can answer a few questions. And once you answer those questions, it's going to be able to identify your risk, whether you're at risk for falling or not at risk for falling. So then when we talk about pitfalls in your home, so one thing I want you to know is that every 19 minutes, an older adult dies from a fall. So this is an alarming statistic. And where do falls occur? We see that 55% of falls occur inside the house, 23% of falls occur near the house, and 22% of falls occur away from home. So that might mean you're out at the grocery store, you're out at a neighbor's house or friend's house. And so we're going to break down the types of risk factors for falls. And we're largely going to talk about today the physical risk factors, the behavioral risk factors, and the environmental risk factors. So with physical risk factors, this relates to changes in your body that can increase your risk for falling. That can be impaired balance. That's an example of a physical risk factor. Also, you see the body conditions that decrease your safety can include pain, weakness, sensation loss, poor balance, poor vision, and then medications. And then your behavioral risk factors are things that we do or don't do that increase our risk for falling. For example, not asking for help when doing something that might cause a fall, taking unnecessary risk, rushing, inattention to task. Those are all things that are behavioral. And then lastly, we have environmental factors. So environmental risk factors are typical hazards in our home or our community, such as loose throw rugs, unclear pathways, or even pets that you have on the floor. And so these are hazards that exist at home in the community, and we're going to address some of those now. So let's talk about those physical risk factors. So physical risk factors are largely related to decreased strength, balance changes, visual changes, medication, or blood pressure. So we're going to make an action plan to see what we can do for some of those things. So let's talk about exercise. So exercise is a great plan to help you improve your strength. Okay. If your care team has deemed it safe, so your doctor, your nurse practitioner, they say it's safe and you can exercise, begin an exercise routine. Have a conversation with your doctor regarding your risk. You may benefit from a referral to see a physical therapist or an occupational therapist to be able to help you begin your journey of being active. And then it's important to participate in at least 150 minutes of what we call moderate intense physical activity. We want you to participate in aerobic training, like walking, strength training, like maybe doing some light weights or resistive bands, and even balance exercises. And so we'll talk about all of those types of exercises a little bit more. So when it comes to exercise and the benefits of exercise, exercise is going to help improve your muscles and make you stronger. It's going to help keep your joints, tendons, and ligaments flexible. It's going to improve sleep. It's going to help decrease your anxiety. It's going to improve blood pressure. It will improve your bone health, and it will also improve your balance and your coordination. Now, I mentioned balance a couple of times now. So, an action plan for you all is to participate in balance training. Balance training can help you improve your balance. It helps maintain your stability, it improves your reaction time, improves your coordination, and it helps you reduce the risk of falls and injury. So, participating in community falls prevention program or community balance programs are great. As we go through, there is a resource to find evidence-based programs that are in your area to be able to help you find those balance programs. And studies out there tell us that balance training should be done at least 3 sessions per week to be effective. Some of those balance activities might include Tai Chi, which that is a type of activity that can improve your coordination and your stability. Simply going from sit to stand from a chair at home. That's a form of strength training. And then we have yoga. Yoga can help you increase your flexibility and your range of motion. And then the other thing you can do is talk to your doctor about referral to physical therapists to be able to help with balance. Another thing that I want you to put on there for your action plan is to have your vision checked. So have a conversation with your eye doctor. It's very important to have at least one eye exam every year. There are three main types of risk factors, and we're going to talk about them individually, okay? But most falls experienced by older adults sometimes result from the interaction between a number of factors, okay? So we don't all have all the risk factors for fall. We each have our own set of risk factors. And so you can start by making a plan to see your eye doctor and having a conversation with your doctor. So ask for an annual eye exam after the age of 50. Sometimes you might need multifocal lenses because your vision might be blurred or distorted. Use separate reading glasses. So you might need reading glasses and then you might need glasses for being up and walking around. If you've been told you have cataracts, you might need to have those cataracts removed because this can also help you see clearer and reduce your risk for falling. And then another thing I want you to do is talk to your doctor or your pharmacist about medications. This is really important because medications can often cause dizziness, they could cause low blood pressure, they have different interactions. And so, talking to your doctor or your pharmacist about how your medications interact with each other is really important. Then I want you to talk to them about performing a yearly medication review. So, you know how when you get new medicine, you go to the pharmacist, they ask you if you have any questions. Actually, set aside a time to do that with your pharmacist to find out about your medications. And then be sure that when you do get a new medication that you read the label. And another important factor is to use one pharmacy, okay? Because if you're using one pharmacy, that pharmacist has a relationship with you and can be able to review those medications. If you're using multiple pharmacists, they might not have a list of all those medications to be able to tell you how those medications are interacting. Then we talk about your blood pressure and your fall risk. So one of the things I want you to do is have your blood pressure checked regularly. Speak to your doctor about how often you should have your blood pressure checked. If you get dizzy when you stand up, see your doctor, talk to your doctor about it. If you get dizzy, you might need to do a sit to stand blood pressure check. So that's a good indication of how your blood pressure is changing from when you lie down to you sit up to you stand up. And if there are changes in your blood pressure that your doctor should know about, these can be recorded. Then some blood pressure medications can increase your risk for falling. So you want to speak to your doctor. If you're on different blood pressure medicines, your blood pressure drops suddenly, that can put you at risk for a fall. And then be very careful after beginning a new medication, okay? So all of those things are important, and those are some of the things that you need to have that conversation with your doctor about. Then, what can you do to manage your risk? So, you can definitely do things to manage your physical risk to help you prevent falling. So, exercise definitely focusing on balance training and strength training can help you reduce your risk for falling. Having your doctor or pharmacist again review your medications, making sure you have your vision checked on an annual basis, and then making your home safer. So, we're going to talk about making that home safer a little bit more. So then we have these behavioral factors. Okay, so some of the behavioral factors that you see is we pick up or we reach for objects. So reaching for items in an overhead cabinet might be something you do, or you pick up an item off the floor, standing on a step stool or a ladder. These are all behavioral things that put us at risk. Things in the bathroom, lighting in the bathroom, a slippery tub or a shower, a low toilet height. Things in the kitchen that might occur is commonly used items that are out of reach. So you reach up high to get them, or you use a step stool. Those are all behavioral things that put us at risk for a fall. And so, what can we do? What action plan can we make to help us eliminate some of those risky behaviors? So ask for help to obtain objects that you can't reach. Do not use step stools, chairs, or ladders to stand on. Use assistive devices properly and as needed. Plan ahead. Don't rush. Don't move too quickly. All of these can increase your risk for tripping or losing your balance and then resulting in a fall. And then discuss a referral for a PT or OT, which can help you identify safety issues in your home and provide solutions to help with fall prevention. So managing your behavioral risk factors. So what can you do? I want you to be mindful of reaching for objects or standing on step stools and ladders. I want you to wear proper footwear at home, and in the community. Ask for help when you need it. I want you to slow down. And again, discussing that referral with the PT or OT services with your doctor. And I mentioned that a couple of times. So, with these behavioral risk factors, now I'll tell you a little story. My mom might be on this presentation today. I don't know. But I use her all the time for an example. So, being mindful. She has been that person that used a step stool and stepped up on it and lost her balance and had a fall. It was terrifying for her because she could have fallen and hit her head on the counter. She has been that person who doesn't necessarily wear proper footwear. She might wear Crocs sometimes, and those Crocs that have your heel out in the back, sometimes they slip off your feet too quickly. And so that's been something that we've talked about is to wear proper shoes with that's closed, your toes are closed, your heels are in, so those shoes don't come off very quickly. So all of these things are things that you can do to help you manage those behavioral risk factors. And then we have environmental factors. This is another big one. So 3 out of 4 adults want to be able to stay in their home. So people want to be able to age in place. So what I want you to do after we have this conversation is I want you to take a look around your home and I want you to remove hazards or ask someone to help you remove the hazards that put you at risk for falling. And common locations that put you at risk in your home include the entrance of your home, bathrooms, and kitchens. So let's take a look at how we can modify some of these things. So let's take your home entry, for example. Maybe you need handrails. Maybe there's uneven surfaces. Take a look and see. Maybe there's a doormat that's in the way that's a tripping hazard. Maybe that needs to be removed. Then in your bathroom, maybe the lighting is not good, so you can't see when you go in and out of the bathroom. Maybe you have a slippery tub or shower floor that needs some attention. Maybe your toilet is too low and you can't get up and down safely from the toilet. And then things in the kitchen. So maybe you've been reaching up high or stepping on a step stool to get items out of an overhead cabinet. Commonly used items in your kitchen, put them within reach so you don't have to do that. Step stools, get them out of there. They're a really big risk. Okay, so what can you do? You can actually bring those items closer and you wouldn't need that step stool. And then do you have throw rugs or mats in your kitchen? And do they commonly, kick up on the end? Can you put some double-sided tapes on those things so those things don't come up off the floor easily? And when possible, you might need to eliminate some of those things. So you can reduce your risk at home and in the community by just changing some of those environmental factors. So identify and eliminate fall hazards in your home and your community. Declutter your space. Consider those throw rugs. Do you really need them? And if you do need them or you want to keep them, they might need to be secured a little bit differently. Look out for slippery floors. Maybe we need to change the type of flooring or we need to put something on the floor so it's not as slippery. Remove obstacles in your path. Be mindful of uneven surfaces that are out in the community. And uneven surfaces could be as simple as you're walking outside your home, you're walking to the grocery store, and the sidewalk is cracked or the sidewalk is uneven. You need to be aware of your environment at all times when it comes to that. And then another risk factor is lighting. Okay. So poor lighting, including dim lighting, can cause a poor glare or reflection, and this can increase your risk of falling. Okay. So it makes it more hard or more of a challenge to see things, the uneven surfaces or changes in elevation or the increase from the glare. So you can't identify the tripping hazard. Lighting can also impair your vision and make it difficult to discern between, what's an even surface versus not. And especially in stairways, that can be dangerous. And then poorly lit staircases are particularly dangerous because they contribute to a higher risk for falling because you can't see as you touch one step and go from one step to the next. So make a plan for adequate lighting. If you know that lighting in your home is not necessarily the greatest, make a plan. Reach out to a local contractor that's certified that can come in and make some changes to the lighting. You can use blinds or curtains to help minimize glares that come in through your room, and that can help with seeing better as you navigate your space. And then if a fall does occur, the first thing you want to do is you want to check for injury. You want to call for help if needed. You want to seek medical attention right away if you've hit your head. You want to call your doctor and let your doctor know that you had a fall. And then you want to check for safety hazards, like what contributed to that fall? What was in the way? Why did I fall? Ask yourself those questions. And then you might want to work again with an occupational therapist or a physical therapist to be able to learn what is the best and safe technique to be able to get off the floor in your environment. Okay. Now we're going to address some risk. And what we're going to do is we're going to take action. Okay. Because there are things that you can do. So again, discuss a referral for physical therapy or occupational therapy services, which can help you identify safety issues in your home and provide solutions. Because what I will say is that everyone has a unique space, a unique home, a unique environment. And so for someone to come in and identify those risk factors with you and go over that with you to make your home safer is really important. Then you can reach out to a certified agent and place specialist. That's someone that's they're going to come in, they're certified to be able to look at your space in your home for your safety needs and your accessibility needs and make recommendations. And then take steps to reduce your risk. So once you've identified some of those risks in your home, go around your home and see what you can do and what you can change. And so it's really important because I want you to know that you can reduce your risk for falling. You can talk to your healthcare provider about reducing your risk. If you have fallen, you're afraid to fall, or you feel unsteady, I want you to talk to your doctor. Review your medications with your doctor or your pharmacist. I want you to stay active. Participate in community-based programs. Participate, when your children or your grandchildren come over. That's very important to stay active. Check your eyes, check your feet. Speak to someone who can check your home for safety. And remember, your physical, environmental, and behavioral risk can impact your risk for falling. Now, some of the resources that the Administration of Community Living has is falls prevention. It's a senior nutrition and falls prevention site where it has some great resources about falls prevention. And then there's also evidence-based fall prevention programs. So these are programs designed in the community that have evidence-based programs in which they work with seniors to be able to do different programs to work on balance and to work on your safety. So this is a great way to find out what's in your area. A lot of these falls prevention programs are free for you to attend. So I would just say use that link. Ms. Telesford is going to put it in the chat, but use that link and find out what programs are available to you. And then some of those community-based resources in those community-based programs can be at local senior centers, area agencies on aging, local hospitals or community centers have programs. YMCA's have programs like Tai Chi, and they also have a lot of evidence-based falls programs. And then occupational therapy and physical therapy services that might be at your local outpatient clinics or your local hospitals. And sometimes I know the greatest challenge is just finding the program in your area. But if you start with some of these community-based resources that we have listed here, some of these programs will get you in the right direction to a program that you need to be able to attend, okay? And especially like your local hospital. So I would just say check the websites for the fall prevention programs that are in your area to actually see what classes and what activities are available. And just like I had mentioned earlier, next month, September, which is right around the corner, is National Falls Prevention Awareness Month. There'll be a lot of activities going on, a lot of promotions around fall prevention. Because not only do we want to prevent falls, we want to prevent injury from occurring as a result of the falls. And so now I think I'm finished. I finished a lot earlier than I had anticipated, but I'm going to go to the chat and see if there are any questions that you all have in the chat. And
Keisha, and we
Sal's
do
for
have some wonderful questions. Thank you so much for
thank
joining us
you.
this afternoon. And if your mom has joined us this afternoon, I'd like to give her a special shout out for joining us. Thank you. And we do have some wonderful questions in the chat, and I'm going to kick us off because something you said resonated with me, and I'd like you to define, please, the difference, Keisha, between an occupational therapist and a physical therapist, please.
Okay. So I always say I have my probably my own definition, but the physical therapist is going to help you more with your mobility. So your walking, your balance, your transfers, using some of those assistive devices. So I used to always tell people, a physical therapist is going to help you get to where you're going. An occupational therapist, we're going to help you know what to do when you get there. So, occupational therapists work more on function. They work more on your functional ability. So, your ability to dress yourself, bathe yourself, the ability to be able to live in your environment, to cook for yourselves, to be able to do daily activities like pay your bills. We also help people with assistive devices because a lot of times that comes into play when you're using the bathroom or you're getting in and out of your house. But that's probably my best summary of it. Physical
Okay.
therapist is going to help you get to where you're going, and occupational therapist, we're going to show you what to do when you get there. All about
I,
function.
I like that definition. And someone asked, they say, I'm a recreational therapist and wondering if there are any relevant interventions preventing a fall.
Yes, I would say for recreational therapists, a lot of our recreational therapists, they look at activities as well. They look at an individual's leisure skills and what they do for enjoyment. So some of the recreational therapists that I have worked with in the past, we work closely together as the OT and the rec therapist because I will ask my recreational therapist, hey, can you accept, can you identify what their social skills are? Can you identify, what is the quality of life index? What are the things that they enjoy to do, they like to do? And based off of some of those answers, then together as team members, we can work together and you can say, hey, Miss Susie likes to go out in the garden. That's part of her leisure skills. Then I'm going to go out in the garden with Miss Susie to make sure that she's safe, that we use techniques where maybe we can put a little chair down there so she's not leaning on the ground and bending over and increasing her risk for falls. So I think as a recreational therapist, looking at the activities that individuals enjoy doing and then identifying, are they at risk? How safe do they feel during those particular activities, and what we can do together to work together to make those activities safe. And if you see that there's a problem in doing some of those leisure activities, identifying that and saying, hey, you know what? You might need to go see a OT or a PT and try to make that activity a little bit safer.
Okay. And Keisha, does Medicare and or private insurance pay for a recreational therapist, occupational therapist, and a physical therapist?
So with Medicare, I definitely can speak to physical therapy and occupational therapy. And then I might let the rec therapist chime in a little bit. But typically in my experience, when occupational therapy, physical therapy, and recreational therapists are a part of like an inpatient rehab center or a community-based wellness center, all of those services can be covered. But Medicare does cover physical therapy and occupational therapy services with typically a physician referral. In some states, it's a little bit different, and you don't need a physician's referral because you have what we call direct access. But I always say it's safe. be on the safe side, get a physician to refer you with the prescription to occupational therapy and physical therapy services, and that is covered by Medicare. Okay.
Okay. Okay. And is there a general time frame that Medicare will cover?
Well, Medicare has a rule that services have to be generally a medical necessity, so medically necessary services. So as long as your physical therapist and or occupational therapist can justify the services that you're receiving, that you need those services to continue to make you better, they'll be paid for and covered. Once you're no longer needing those services where they're not medically necessary, then the Medicare is no longer going to pay for those services. So when you make progress and that PT or OT writes you off and says, hey, you met all your goals, you're doing great, then Medicare is no longer going to pay for those services.
Okay, thank you. We have a question in the chat, and it speaks to dehydration and wanting to know if dehydration can contribute to a fall.
So it can. So our all of our hydration levels can contribute to a falls. Our different I guess I could even say even down to like a urinary tract infection sometimes when things get off and people get confused and that can contribute to a fall, but it could. So it could cause, I think like noted in the chat, it could cause your muscles to be a little bit weaker. It could cause you to be a little bit weaker. So yes, dehydration could indeed lead to a fall. So when you, I want to say when you feel like things are off, or if you're caring for a loved one and you see that, well, maybe they're off balance or they appear to be weaker, the best thing for you to do is consult with your medical provider, call your doctor, let your doctor evaluate that individual and see what's going on.
Okay, thank you. And while we wait for questions to come in the chat, I have a question, and you spoke to the importance of lighting. And as a caregiver, I know that it is really important to have multi-layered light in the home. And what I mean by that, I'm speaking to table lamps, floor lamps, overhead lighting, and maybe even a few sconces. That's expensive, very expensive. Are there any resources available, or might the agencies you reference, might they help cover the cost of lighting?
So some programs do. In fact, HUD, they actually have a program. It's called the Older Adults Home Modification Program. And with that program, there are local agencies. Some of them are nonprofit organizations in your community that actually have received funding for this program. And through that program, an occupational therapist actually can come out to your house, can do a home safety assessment, and can do some of those repairs, and lighting is included in that. What I will tell you with that program, though, that program, you have to be over 62 and you have to meet certain income requirements to qualify for that program. There are other programs through organizations like Rebuilding Together. They also work on home modifications. Again, that's largely income based. I recently found out about another program, and this is a nationwide program. It's called the Shepherd Center. The Shepherd Center is an organization of many volunteers, and so they can come out as well and do modifications in the home to be able to help. Because you're right, some of this can get expensive, but some of these things I always tell people. And I don't have any stock or money in Amazon, but some of these things you can go on Amazon and you can get some low cost things that can have a high impact for safety, even things like night lights or lights that go underneath the kitchen counter or underneath the bathroom counter. So they're motion detected when someone walks in a room, they actually activate. So there are some programs, but that's why I said reach out to those local area agencies on aging. as well, because some of them partner with some of these organizations that I just mentioned to be able to have someone come in and do some of these things for you.
Okay, and to your knowledge, when you speak to home modifications, are they for homeowners or renters? And if in fact I'm a renter, can I speak to my landlord about making some of these modifications if I want to age in place in my apartment?
Okay, that's a good question. So I would say the HUD program, actually, the Older Adults Home Modification Program, that program applies to individuals that own their home and individuals that rent their home, as long as their name is on the deed or the lease, and they qualify. Those modifications can be done. Now, if you live in an individual apartment, um, and under the ADA Act, I think it's reasonable accommodations for your landlord to make some of those accommodations, like a grab bar. A ramp might be a little tricky because of cost sometimes, but through the ADA, the Americans with Disability Act, some reasonable accommodations should be made by landlords to accommodate you. But again, I would say, because if you don't reach out to the program, you won't know. And a lot of times people think that programs, you have to own your home. But I've recently found out there are some programs that you don't have to own your home. You just need to meet the qualifications and be someone maybe over the age of 62. And they are able to help you out.
Okay. And then I'm going to stay on this in the environmental space for a moment. And again, I welcome our audience to keep those questions coming. They were great. And as Keisha and I chat a bit, I'm going to ask you, Keisha, to please speak to hoarding. You spoke to clutter, but I want to ask about next level, hoarding, and how important is it to just really clear out the clutter and create negative space in our home? I mean, it definitely feels good, but I'm guilty of it too. We like to hang on to our stuff.
So, oof, that's a hard one, because a lot of
Yes.
times some people that hoard things, that are hoarders, they have more of a psychological condition that makes that difficult. But when you just kind of keep buying stuff and keep buying stuff because it's kind of a habit, then that's a little bit different. So what I generally tell people is look around your home, look around the room that you're in, and really identify the things that you use. And sometimes I've done this with people. I'll say, by the next time I come back, if you hadn't used something, I want you to put three things to the side that you'd be willing to get rid of, because somebody else needs that. So I take it from that perspective, is where we're not throwing it away, because it's a value to that person, that individual. But I try to spin it as you can help somebody else, but you're not using it. So give me three things. And we start there. We start with three things because I know I can't take everything all at once. Um, but if you insist on keeping those things in your environment, the biggest thing you can do is just clear your paths. I always tell people that make a path clear. You need a walking path in your home. You need to be able to see. You need to be able to safely get up and down from furniture, in and out of bathroom, in and out of your bed. So the path that goes to those areas, it has to be clean. So we have to move all stuff back and move it up against a wall, make sure it's sturdy and it's not going to fall. But we have to have a clear path to things. We have to move cords out of the way. We have to move those throw rugs out of the way, because those are the things that we trip up on and make us fall. So clutter, getting rid of clutter is really, really important. But we do it in small stages. Because if I go in and try to clear out everything out of somebody's house, I know I'm gonna have a problem. So just working small little steps and using that kind of that rule of three. And so each time you go visit, just say, what's three more things we can give out? and then actually show the impact that what you gave away actually is helping somebody else. So that's what I like to do.
I like that. And as a lover of throw rugs, I'm going to go home today and think about the three throw rugs that I might donate. So thank you for that advice. And while we're in the space of environment, just one last question. It is my understanding as a caregiver, the bathroom is the area in the home that falls happen the most. And so how can you keep a bathroom floor, which does get wet when we shower or bathe, without throwing a bunch of towels down or rugs? How can we stay safe in our bathrooms and not slip or slide across the floor?
So with that, you're right. Bathrooms are an area that a lot of falls occur in. Commonly, things that we can do is install grab bars, especially for assisting around the toilet, getting up and down, and getting in and out of the shower. In the shower, a common fix sometimes is to put non-skid strips in there so that your feet don't slip when you're in the shower. Um, I know I said remove those throw rugs, but stepping out of the shower is a place where you could slip and fall. So you want to make sure you have a mat, again, that is a non-skid mat that isn't going to move when you step out of the shower. But for the floor in the shower, this is more of a long-term kind of fix. But there are things that you can work with individual contractors where if you have a floor that is really slippery, they can do something to almost cover that floor to make it a little less non-slippery. And it's not like a non-skid floor, but it's just to give the floor a little bit more traction in it because sometimes those tiled floors can be slippery. But the biggest thing for the bathroom is to remove anything along that pathway, like those rugs that you could trip up on and hit something. Implement those non-skid mats for stepping out of the shower, the safety strips in the shower, and then grab bars in the bathroom.
Okay, thank you very much,
Okay.
Keisha. And our chat asks, how many medications can you safely take before becoming at risk for a fall?
So I was trying to find something because I just saw that question because it was a guide and I can't remember who had that guide out. But typically it's more than it's a criteria. I think it's called the Beers criteria, if I'm not mistaken. But typically when an older adult is taking more than six medications, that can put you at risk. We say individuals that take six or more medications is at risk for a fall. So that's where I say, again, using your doctor and your pharmacist to take a look at all those medications and identify what are the medications that could cause dizziness, what are the medications that could cause you to have a fall, and really talking about those particular medications. Okay. So if you are on six or more medications, then that could increase your risk for falling. Okay. And I was trying to find that Beers criteria for you, but it's spelled Beers. And this is something that was put out by the American Geriatric Society, just talking about medication and risk factors for older adults. And I would encourage you, talk to your doctor about it and just say, hey, I'm on six medications and I heard this puts me more at risk for a fall and talk about it. Okay.
Okay. And so just to build on that a little bit, Keisha, how do you get your care provider team on one page? Are your care providers, if you have multiple care providers, are they inclined to jump on a call with you? Do you take a script to each one of them? How do you bring them all together so they know about you?
Ooh, that's $1 million question. So, let me see. I'm gonna be honest. So that's very hard to do. It's very hard
Yes.
to do because many of us see many different doctors in many different systems. So I might have a cardiologist, and this cardiologist might be affiliated with a whole nother hospital, whereas three of my other doctors might be at a hospital. Um, So I do know they're, popular as electronic medical records. So yes, your doctors, if you're in a system affiliated with the same electronic medical record, the doctor might be able to see it. The doctor might not be able to see it. But I always say the best thing possible is to keep a list of all of your medications. Have a list of all of your medical providers. And when you go to your doctor, start the conversation. It's your time. Start the conversation when you get there and like, these are all the updates. These are my doctors I go see. These are new medications I've been on since the last time that I came to see you. And that's hard to do because not everyone has a caregiver that's going to the doctor with them. So I always encourage individuals that may not have a caregiver, write it down, and when things change, you keep updating it. Or take that last after visit summary from when you went to Dr. A and take it to Dr. B. And then demand kind of that time on the end of your visit or the beginning of your visit to have that conversation with your provider. A lot of times now we're rushed in and out of our appointments, but when you kind of put it out there, is the doctor going to answer you or not? You put it out there and you advocate for yourself by saying, I want to go over this because these are the changes since I last was here and talking about it. Okay.
Okay, and Keisha, I want to thank you because one of the pieces of advice you gave me as a caregiver is to take the medicine with me. And I take it to all appointments, including the dentist, the podiatrist. It makes a difference in terms of one's medical care. So just take it with you. Sometimes you might be over medicated, and that care provider will discontinue the medicine or change the milligrams that you're taking. So take it with you. Just put it in a bag and throw it in your tote and take it with you. And so I thank you, Keisha, for that advice. We have a question in the chat, and it reads, it says, thank you for this informative webinar. How do we encourage our older loved ones to address behavioral risk like slowing down when they're accustomed to handling everyday tasks in a rushed manner?
Oh boy. Now that's a hard one too. Uh, but I think from an understanding and perspective that, I always say we're all aging. Um, and we're all used to doing things a certain way. And we have a certain lifestyle that we're accustomed to. And so I always say, think from your perspective of how you'd want to be treated and what you would want and how you would do it. So, in having the conversation, because I do this a lot, I've noticed mom or dad or Aunt Susie or whoever, X, Y, and Z. And I think if you slow down a little bit, you might reduce your risk for falling. Or, hey, you know what? I'm going to come home and I'm going to help you clean out this room. And it's going to be something that we do together because I want to go through some of those old photos or I want to go through some of those old magazines and maybe I can use those magazines for something. So it's almost like you have to engage with those older loved ones. And you have to participate. You got to kind of show a why. And you can't just get rid of things because I've tried to do this with my mom. And again, I don't know if she's on here or not, but if she could talk, I'm glad she came on here on the web because I'm always trying to get rid of stuff. And I can appreciate that, you're the older adult or loved one in your life is wanting to keep stuff and do things. But I think we have to give an alternative. For anything that we take away, we have to be prepared to give some type of alternative, and maybe we can try this. So if I know that my mom is still gonna, she wants her, a good example, she wants the filter changed, and she's gonna get on the step stool to change that filter when it needs to be changed. So if somehow I have to say, you know what, I'm gonna send someone over or I'm gonna come visit every so many months because you know what, Mom, I'm gonna start changing that filter. Or I'm gonna send someone by and they're gonna just check around the house. So sometimes we have to, go ahead and be proactive and send that person or send someone to do it, because if not, think about us. We're going to do what we want to do when we want to do it. So we got to kind of have a happy medium and kind of help our older adult in our life solve some problems and maybe send somebody by every now and then to check in.
Well, Keisha, in the spirit of, and I'm going to invite you over to my house and maybe we can get rid of that tennis shoe collection that he just will not part with. And so, as we come to the close of this webinar, I'm going to shift gears a little bit and celebrate your mom and my dad by speaking to footwear and I'd like you to speak to the importance of proper footwear. If you could first define proper footwear, how do we know if that tennis shoe that Air Jordan that we just love, how do we know if that Air Jordan is proper for us now? And then lastly, does Medicare, Medicaid, private insurance pay for podiatry care and subsequent footwear, pardon me.
Okay, so to address that, so Medicare, in some cases, I will say maybe not in all, can pay for proper footwear when there are some problems with an individual's foot. So if someone is seeing a podiatrist dependent now, it's not as much as it used to be because people that had diabetes in the past, they could see a podiatrist and a podiatrist would prescribe good footwear, and it could be paid for. Things have changed a little bit now, but I would say reach out to the podiatrist if you are having problems with your feet to see if they can make a referral for some type of proper footwear. Now, other proper footwear, I would always say we always look for shoes that where your feet are enclosed, so you're not wearing shoes that are going to slip out. Your feet are going to slip out like those Crocs or those flip-flops. We want to make sure that you have good support for walking. They're good supportive shoes. You want to make sure that your shoes aren't too tight. So you're going to have corns or blisters or other problems with your feet. It was a great resource, and I wish I had included it in my presentation about selecting proper footwear for seniors. But also sometimes it's a matter of, is it a shoe that you can slip your feet in that's, closed, like a tennis shoe, but you can still slip your feet in? Because sometimes some older adults have trouble with bending down to tie their shoes, or maybe I think Skechers now makes a shoe that has a heel on the back that you can just slip your foot in so you don't have to get down and do, tie your shoes or stretch out your foot. But you want to make sure that it has a good non-slip sole on the end, on the bottom of the shoe, so you don't slip when you go walking. It just needs to have adequate support. So if it is a pair of those Air Jordans and it doesn't have a non-slid sole on it on the bottom, it does provide good support for your dad to walk in. Yes, would that be a good shoe? Yes, maybe it definitely could be if that is his favorite shoe. Okay.
Okay, and that would include, very quick, house slippers. We need to look for good house slippers.
Yeah, good house slippers that actually have a back on them. So a lot of times the ones that, you can slip your feet out, if you go to kick them off, they can get in the way. So you want something more that your whole foot can go into. Okay.
Okay, thank you, Keisha. We are at 2:01, and I want to respect your time. I want to thank you again for an awesome presentation. And if your mother has joined us, thank you for sharing Keisha with us. And to our audience, thank you everyone for joining us this afternoon. We appreciate you coming out, and we wish you a good rest of August, and that we hope you enjoy your summer and upcoming Labor Day holiday. Thank you and have a good afternoon. Thank you, Keisha.
Bye. Bye,
Bye bye.
everyone. Thank
Bye
you.
bye, everyone.